You have a medical emergency.
You call 911, but guess what? Paramedics cannot get there as quickly as they should because they're answering a call from a place that's notorious for tying up the emergency response system. That would certainly make you angry. It might even make you dead. Who's doing that and why? Here's Larry Barker.
Albuquerque Fire Department, what's the address to your emergency? I'll get a unit rolling up. Just keep an eye on her.
It's an emergency and seconds count. An ambulance tears through the city. But when paramedics reach this address in southeast Albuquerque, they're in the middle of a critical situation. They've been dispatched to an urgent care center.
This is Healthcare Partners. And over the past 2 years, there have been more 911 calls for emergency service here than all the other urgent care centers in Albuquerque combined. So many, in fact, that the number of calls to this address is clogging the system.
Since June 07, there have been more than 200 emergency 911 calls to Healthcare Partners. Compare that to just 31 calls over the same period to Presbyterian's urgent care on Harper. And at the urgent care on Atrisco, in 2 years, 22 calls.
We're continuing to respond to that facility a lot. And to a lot of emergencies, which continues to affect us and impact our service delivery to the people in that area of the city.
In medicine, urgent care fits somewhere between a doctor's office and the emergency room. If you're feeling bad but can't get an appointment with your doctor, then urgent care is for you. The ER is for life-threatening emergencies like heart attacks.
Medical experts allege Healthcare Partners is not taking care of its patients adequately. They claim rather than deal with medical issues, the urgent care sometimes dumps patients off on 911 and lets paramedics handle the problem at taxpayers' expense.
Dr. Barbara McEnany heads up the group that oversees emergency medical services.
They are having patients in the waiting room or in the parking lot call 911 instead of taking care of people. We would like very much to have that activity stop, to have them properly take care of people if they are indeed going to represent themselves to the community as an urgent care center.
For example, this 911 call in April.
I have a gentleman here. I'm with the security department. I was sent into the urgent care. There's a gentleman here. I was told from the lady that's in there that it was an inflated urinary area, is all she stated, and that they're not able to see him due to the fact that it's an emergency situation and I needed an ambulance.
They simply call 911 or tell the patient or a family or friend to call 911 and expect the fire department to provide all of the care.
Albuquerque Fire Department, this is JP. Hey JP, how you doing? This is Vinny Vigil over at Loveless on Gibson. Yes, sir. We have a patient here that's requesting an ambulance. I guess urgent care. She's been there and can't help her.
Healthcare Partners is located in what was once the emergency room at the old Loveless Hospital building. In fact, even though the ER moved out in 07, today some of the old signs are still visible. Some patients could be confused about what really goes on here.
That was Loveless ER for 82 years, and we've only been here for 2. So the public is still getting an education that we are not an ER.
Healthcare Partners urgent care is different in another way. There are no doctors here. This urgent care is staffed by nurse practitioners who are qualified to diagnose, treat, and prescribe.
Irish McCarthy is Healthcare Partners Clinic Director.
Does your staff have the same training and expertise as other urgent care centers in Albuquerque?
Yes.
Even though you don't have any doctors here?
Nurse practitioners are the ones that train some of those doctors, sir.
In your opinion, is Healthcare Partners a legitimate urgent care center?
In my opinion, they're not acting like one.
For close to 2 years, Healthcare Partners has given emergency responders a cold shoulder about the problem.
Basically, they told the board to bug off.
Basically.
Mind your own business?
Yes.
Irish McCarthy disputes the fire department's data. She joined Healthcare Partners earlier this year.
Do you feel that Healthcare Partners has been abusing the 911 system, the emergency response?
No, since I have been here, absolutely not. Prior to me being here, I cannot answer that for you, sir.
McCarthy says the problem is one of perception.
If you ask the average Joe what an urgent care is, they don't differentiate between an ER and an urgent care. And we are trying to educate the public, but we give great care, and we are an awesome urgent care.
Right now, it's, in this case, for this facility, it's dysfunctional and it's broken, and we need to come back to the table and try and see what we can do to fix that.
We give great care. We do not call 911. We have great providers. And am I a little defensive? You bet, because we give good care. And I wasn't here in 2007, and the people that you were trying to get a hold of, they don't even work for our company anymore. There's probably a good reason for that.
It is our job as the authority to make sure that every citizen living in every part of this community has good access to emergency medical services when they need them. I'm concerned that in the Gibson area, that our ability to deliver on that promise is being hindered by healthcare partners.
Larry Barker, KRQE News 13.
Healthcare Partners is now working with emergency responders. Since April, they tell us, the number of 911 calls from that facility is down.